Today's topic is the popliteal vessels. Popliteal artery, it is the continuation of femoral artery. It extends above from the adductor hiatus through which the femoral artery enters the popliteal fossa and changes its name to popliteal artery. It continues downward till it reaches the fibrous arch that is present along the soleus muscle. And soleus is one of the muscles in the posterior compartment of leg. So popliteal artery is the continuation of the femoral artery extending superiorly from adductor hiatus and continues downward till it reaches the fibrous arch over the soleus. The course of a popliteal artery is that it enters the popliteal fossa along the medial side of the femur, where it lies deep but also medial to the sciatic nerve. So here is the sciatic nerve, and medialmost and deepest structure in the popliteal fossa, we have the popliteal artery. And popliteal vein, in the meantime, continues to pass between the nerve and the artery. So popliteal artery continues to run downwards and convexes laterally, lying so that it finally comes to lie on the lateral side of the tibial nerve. In its course, it lies on the popliteal surface of the femur, oblique popliteal ligament, here is the popliteal surface of the femur, and around the posterior aspect of the knee joint, we have a ligament called oblique popliteal ligament. And then further downwards, we have the popliteus muscle. Here in this diagram, you can see the popliteus muscle. And here we have the popliteal vessels along with the sciatic nerve and tibial nerve. Here is the ligament that is shown as the oblique popliteal ligament. So popliteal artery continues to pass under the fibrous arch within the soleus. And in the upper part of the leg, it divides into its terminal branches, which include the anterior and posterior tibial arteries. The branches of the popliteal artery include muscular branches to the calf muscles, among which there are two large sural branches that supply the gastrocnemius. And then it has two sural branches that are given off to the gastrocnemius. The other branches are the very famous branches that arise from the popliteal artery as genicular branches, which are 5 in number. These genicular branches include superior medial, superior lateral, a middle genicular artery, and then we have inferior lateral and inferior medial arteries. These superior and inferior arteries, genicular arteries, they form a very important anastomosis around the knee joint. Whereas the middle genicular artery, along with the genicular branch arising from the posterior division of the obturator nerve, enters the knee joint to supply the cruciate ligaments. And finally, we have the terminal branches of the popliteal artery, which include the anterior tibial and posterior tibial arteries. So here we can see that the posterior tibial artery and then we have an anterior tibial artery that runs within the anterolateral compartment of the leg, whereas posterior tibial artery runs in the posterior compartment of the leg. Palpation of the popliteal artery is very important because of its clinical significance. The method to palpate the popliteal artery is to slightly flex the leg at knee joint and keep the two hands over the palm of the two hands over the anterior or front side of the leg, whereas keep the fingers, especially the index middle fingers, into the sides of the popliteal fossa. And here, within the popliteal fossa, one will be able to palpate or feel the pulsation of the popliteal artery. Also, popliteal fossa, in the popliteal fossa, popliteal artery can be compressed. That is called the popliteal artery entrapment syndrome. It can be compressed by the medial head of the gastrocnemius. Popliteal vein. Popliteal vein is formed by the venae comitants that accompany the anterior and posterior tibial arteries. At the lower part of the popliteal fossa, course is that it runs or ascend between the popliteal artery and the tibial nerve, and it continues to run between these two structures in most of its course. And within the upper part of the popliteal fossa, it enters the adductor hiatus to become and to continue as the femoral vein. Tributaries of the popliteal vein include the veins that correspond to the branches of the popliteal artery and a small saphenous vein. Next, a very important part of the popliteal fossa is the popliteus muscle. Popliteus muscle is an oblique muscle running from the tibia, posterior aspect of the tibia, above the soleal line, continues to run upwards and laterally till it reaches the lateral surface of the lateral condyle of the femur. So its proximal attachment is above the soleal line on the posterior surface, upper part of the posterior surface of the tibia, ascends upwards and laterally to get attached over the lateral surface of the lateral condyle of the femur. The tendon of the popliteus muscle is intracapsular, as you can see in this diagram. This is the lateral ligament of the knee joint, and this hole is the capsule, and this tendon of the popliteus muscle is shown to be intracapsular. So, besides its attachment over the tibia and the lateral surface of the femur, lateral condyle of the femur, some of its fibers also get attached to the capsule and lateral meniscus of the knee joint. Lateral menisci are basically the pieces of cartilages that are present within the joint cavity, and they shall be studied in detail when the topic of the knee joint will be covered. So again, I'm repeating the attachments for the popliteus muscle. Popliteus muscle, it gets attached proximally above the soleal line in the upper part of the posterior surface of the tibia and runs upwards and laterally to get attached over the lateral condyle of the femur. Since its tendon is intracapsular, so some of its attachments are also into the capsule of the knee joint. This muscle is supplied by a branch from the tibial nerve, which is itself a component of the sciatic nerve. This muscle, its action will be described in detail with the movements at the knee joint, because with the movement of the knee joints is associated a very important mechanism of locking and unlocking of the joint. So this popliteus muscle is involved in the mechanism of locking and unlocking of the knee joint, as well as rotation of the femur and tibia over each other.